His immunosuppression has been the plan that we've had all along. We've made only one modification. He did develop a rash a couple of days ago, and that we treated that with a little bit of an increase in his steroid dosing, but other than that, the immunosuppression plan is as it was. It's actually very common for patients to develop rashes in hand transplant patients after transplantation. Most of our patients have multiple episodes of what is, for the most part, easily treatable rejection episodes. We're thrilled. Donnie has done incredibly well. His hand has minimal swelling relative to some of the other hand transplants that we've done in the past. He feels good, and he's got excellent motion given how recently the transplant was put.
Donnie's doing exceptionally well. He was here earlier with his physical therapy, and his range of motion right now is far superior at this stage than we had several of the others. I think his determination is excellent, his outlook is good. Of course, as he says, he can move his fingers and he can grab things with the outriggers, but he has no sensation. And sensation is going to take about another 4 to 6 months before he starts feeling things. So right now he's at a point where he can move things, and he's still in an outrigger. And it'll be about 2 weeks before we let him get out of that and start picking up things and doing things like that. But we have to watch it because he has no sensation, so that makes a difference in what you're doing. But he will progress to, in about 2 or 3 weeks, he'll progress where he'll be picking up pegs and things like that to do more functioning with his hand. But he's been doing well. His chemistries have been good. He's had no reactions at this particular point, no rejections, which is very good. We had a little scare on Sunday, but we're not sure. It was a rash. It didn't last but a few hours, but it's cleared up pretty well. But so far we haven't had to worry about it. He's been doing, range of motion is good. He has a little lag in his little finger, but we feel that's a tightness that was put in. But over with the type of brace he has, that's stretching out. So no, we're not concerned about that at all. Well, the outrigger is really a brace on that has rubber bands attached to it. And the rubber bands are so that when he flexes his finger, the natural position is the flex. And if you know, even when you're sleeping, your hands are flexed and bent. So that's a natural position. So to overcome that, we put him in an outrigger that holds him up so that he can flex against that. But the rubber bands, before the rubber bands take effect, I should say before the muscles to extend his fingers take effect, the rubber bands pull him up. So therefore he gets motion in both the flexors and extensor tendons, but he's got less likely that they will adhere or scar, and so he is more likely to continue motion the proper way. So it's an aid to getting to do the range of motion that we want him to do with protection, so he doesn't rupture the repairs.